is Maxine Holt. And Maxine, you're from Manchester Metropolitan University. And
I am.
Man-Met,
yes. Yeah.
You're the principal lecturer in public health, and one of the key features in your role, I understand, is of coordinating Health Universities initiative.
It is, yes.
So I'll just let you take it away, and I'll give you a 5-minute wave.
Okay, thank you. Good morning, everyone. Thank you for coming along. What I'd like to do this morning is just present a small-scale study we did in the UK, a consultative study with students which aimed to explore what students thought a healthy university was. Now, if I just explain why we did this study, we're very, very early. Morning. We're very early in our journey towards becoming a healthy university in Manchester Metropolitan University. And one of the things we did do was take a brief self-review using the self-review toolkit that Mark Duris explained a little bit about this morning, and he's going to talk a little bit more about tomorrow, to look at where we might be at the beginning of our journey, what staff thought about us as a healthy university, and what students thought. And one of the things we did find from the study was that actually we needed to consult a little bit more with students, and this is why we undertook this piece of work. So it was a consultative piece of work which helped us understand a little bit more about what students thought or think a healthy university is. And what we wanted from it was to be able to use it to inform our further development within our own organisations nationally, because Manchester Metropolitan University is very actively involved in the UK Healthy Universities Network, and to help other universities that may be beginning their journeys. We took two methods in gathering our data. We used opportunistic surveys, where we asked students to complete in writing the sentence, "A healthy university is one which." And we also carried out focus groups where students were asked to bring along an object or something, a visual object, which to them represented a healthy university. And this object was quite often used as an icebreaker or something that stimulated discussion. Students brought along things like bottles of water. We had a lot of bottles of water. Brought along food, apples, pictures of bicycle sheds for chaining their bicycles up and things like that. So we used semi-structured questions in the focus groups, which were around the topic of, please could you tell us what your object is and why to you it represents a healthy university? What do you notice immediately when coming into a university? What do you think is a healthy university? What would be present in a healthy university? And what are the most important of these? 11 universities participated across the United Kingdom, England, Scotland and Wales in the study, and these included 423 students, with 367 of them from student surveys and 56 from focus groups. We used what we called a priori themes in order to undertake our analysis. So we looked at the Healthy Universities Network, the UK Healthy Universities Network, documentation around what they believe completes a healthy university, the whole systems approach, and the self-review toolkit. So these were our main themes that we used in order to undertake our analysis, and I'll show you a slide with that on in a moment. So our model was derived from documentation from the UK Healthy Universities Network. The responses were transcribed and the a priori themes were coded thematically, and from this we developed our sub-themes. And this is what I mean. So the bigger circles you can see were our a priori themes. That's what we think represents the whole systems approach to a healthy university. And this is available from the Healthy Universities UK network. And these were our sub-themes that we analysed and placed under each of those headings. And what I'll do as I go through the slide, I'll present the analysis of each of those themes under the key circle areas. So what did we find? Well, under facilities and services, students very much believed that food and water stations, this was a very, very key predominant theme throughout the whole study across all of the universities, that access to a variety of healthy foods, reasonably priced foods, and water stations were very, very important to students. So students thinking that the cheaper healthy university would have cheaper food options, and mainly the unhealthy options such as chocolate was actually always cheaper than the healthy options, and this caused a dilemma for the students, particularly when they start to look at money and cost of being a student. An on-site gym, provision of sports facilities was important at reduced prices, and students could have reduced gym membership prices, and that students believed a healthy university would make exercise a concern and priority of all student health within the university. Bike shelters and car parking. Interestingly, bike shelters more importantly than car parking. Many students understood that actually to be an environmentally friendly university, driving to work was not a good thing to do, so they would much prefer to cycle. And access to health services. Students wanted quick and appropriate access to health services through their university. They needed to be convenient and efficient and able to suit them. So these should be appropriate to student needs, they should be on campus and very, very close by. In terms of our other key area in our Healthy University model, the policies, students discussed healthy policies predominantly in terms of food options. So again, very much seeing that a healthy university to them would make sure that it had healthy food policies. And linking it to facilities as well. Students believed a healthy university would be a safe place to study and live, and they linked that very much to the environment. It would meet all the regulations for inclusion, recognising diversity of student population, and it would consult with students, communicate effectively, and where necessary, adapt to change. So a healthy university for our students would respond to criticism, would adopt to individual needs, and leads the way in constructing and implementing the latest government strategies in terms of health and well-being and sustainability. A healthy university would ensure that its policies encouraged and provided incentives for students to be healthy and well. And there would be a balance between the core educational focus of the organisation and the health and well-being of students. So for a student, a healthy university would be willing to share its financial wealth in order to establish that students are experiencing their peak spiritual, emotional and physical health. In terms of the environment, a lot of students across all the universities talked about that general feeling you get when you walk into a university. So they talked about the ethos that when you walk in, they would feel straight away this was a good place, a healthy place to be, to live and learn. So first impressions were important in helping students choose their university, and key to this was the way in which university staff, and particularly tutors, presented themselves. So on open days, induction days, freshers, were tutors calm, friendly, and did they look like they would be supportive people? So a healthy university would be warm and friendly. It would have a warm and friendly atmosphere, so students would want to attend. Teachers who were there to support the students when possible, and one where students and teachers were respected and feel comfortable around each other. And I quite like this one. Somebody just simply said a healthy university would just get people smiling. In terms of the environment, students believe a healthy university would be clean and safe. It would consider its nature, sustainability and green issues, so the location of campus buildings was an important one. Some of the universities that participate in the study were city universities with very little green area around them, and many students were concerned about this and felt that that was an important part. They needed that as part of their studies. So the buildings needed natural daylight to promote a sense of well-being, and a healthy university would actively prepare students as global citizens who considered important issues such as environmental issues, recycling, and how to live and work in harmony with each other. So a healthy university would have pride in its environment and the environmental factors that affect the world, and encourage students to use the bins and no smoking areas all over campus. In terms of health and well-being issues and behaviours, promoting health was seen as a key important factor for all of its students, and should be a core fundamental feature of the core business of a university. Many students believe that providing resources and facilities on its own was not enough. This is needed to be actively communicated to students through their lectures and through their tutorials and in other ways. And that a healthy university would reflect and comment its commitment to well-being through inclusive processes and speaking to students, consulting with students about what makes them healthy and what might they need. So a healthy university would inform students how they can live healthy every day and help them when they feel they need help, especially when they are stressed, depressed or burnt out. It would allow opportunities for individuals to define what makes them feel healthy through the activities, all types of activities that could be created to environmentally and theoretically prosper. In terms of the curriculum and personal development, a healthy university would have supporting lecturers, and students believe these would be outstanding lecturers who were able to support students with both academic and personal development through the curriculum. It would have a student interest deep at heart and strives to give the students the best education possible with the greatest choice of employment at the end of their studies. It would have a well-planned curriculum and promote health through its curriculum. So many students saw this as being very fundamentally important, that it wasn't just about those students who studied health-related programs, that all programs, that the actual organisation itself would have a health-promoting curriculum. Students believe a healthy university lecturers need to promote health in lectures and encourage students to be healthy. They're not there just to teach the subject. Students very much felt that a healthy university would have a strong relationship with its community. It would have external and clubs and social interaction. Many students looked to these as a means of making friends when they were new to university, first years, first time away from home. They felt a healthy university needed to consider this so that they had somewhere to go to socialise and make new friends. They would have extracurricular activities to develop and help students become involved in community groups. And some students felt that a healthy university should actually be a community of its own, developing its own characteristics and its own ethos. It would feel like a community as opposed to a cold organisation. In terms of research, students didn't relate research specifically in terms of healthy universities as being important. What they tend to communicate research more around having excellent lecturers, knowledgeable tutors and a contemporary curriculum. Students tended to look at issues discussed so far in relation to facilities and tutor support in terms of its research profile. So what did all this mean for us? Well, first of all, for students, one of the things that students do come to university with now is a very clear set of values that are important to them. Through programs such as Healthy Schools programs, students come to university with a lot more understanding and very clear ideas about what they want. One of the difficulties is when they get to university, there's sometimes a dilemma with this, and these are overridden by other factors, for example, cost. We have very high tuition fees in the UK, and students are balancing the cost of being a student to other things. For universities, well, it does raise important issues for universities in meeting student need and expectations. For example, there is still a dilemma between free water and the sale of bottled water, and I think every university that we meet in our workshops across the UK, in our network meetings, discuss this in terms of it being a dilemma and also in terms of sustainability. So it does present a difficulty for universities who are selling it as part of making a business. For higher education organisations, the concept of a healthy university that can tailor its facilities and services and its overall offer and needs and expectations of students will support its own institutional objectives relating to enhancing student experiences. It will contribute to the development of students who are active global citizens, able to value and prioritise their own health, in the long term and their short term, and their roles within families, workplaces and communities. For our UK Healthy Universities network and other umbrella bodies, it's important and valuable to be able to find ways to engage with, listen to and respond to the student voice. For our UK Healthy Universities network specifically, this work has actually led to some further work that our colleague Mark Duris will be presenting tomorrow around the self-review toolkit and whether its content needs revision and how other organisations are using it to ensure that the student perspective and students' views are very, very much fully incorporated. Thank you.
5 minutes.
Thank you.
Any questions or comments from the audience?
I'm struck by your last point around for the students, the link to research program is not that strong. And I come from a highly research-intensive university which drives every critical decision at the strategy level. So, is there anything more around that in terms of that particular piece? It's just it drives almost everything we do.
Yeah.
So to sort of have student feedback around a healthy campus that is a little bit not necessarily connected to research profile is interesting.
I think in terms of research profile, what I mean is that students didn't actually, the research, the importance of research to them was as the direction you're coming from. We need to do it as part of our studies, we need to do it as part of our lectures. The organisation itself needs to be research focused, but not necessarily in relation to some of this work that we've talked about. Yeah.
From Lithuanian University of Health Sciences. I came a little bit late and they didn't heard about methodology. But my question is, did you ask the students, do they want to be healthy or do they want to follow healthy lifestyle principles?
Well, that's an interesting one because this particular work that we did was the start of a much bigger piece of work that we took afterwards last year, which is still under analysis at the moment. But what we did do from this was actually look at student health behaviour. And from we asked students 85 very candid questions about their behaviours in relation to their health, their concepts of health, mental health, sexual health, eating, exercise, substance misuse and drug misuse. So yes, we did actually do that, but much later.
Which you showed for us answers for the students. As all the students, I apologize if there are students always asking a lot to have a better environment, to have better food, to have better acceptance to the healthcare. But my question is, do they want by themselves to do something? Because I think that the concept of health promoting universities, we only start with this model. We have a lot of preventive projects in Lithuania, but with this model we start. So I think that the most important that students should change their minding and they should use these healthy environments, not only give, but to do something. You understood, I think.
I think you're right, yes. And I think that students actually do come to university with a lot more ideas about their own health and well-being now. And I think the difficulty for universities is some of the dilemmas we face in maintaining that once they've left school, mainstream schooling. Yeah.
Great.
Thank you very much.